I love this question because it's similar to the question, how many angels can dance on the head of a pin? It's crazy when you look into this, because think about this for a moment. You know, almost every vertebral vertebrae has 6 joints in it. And conceivably, you could have one of those joints subluxated, and it's new, it's fresh, and it requires an adjustment, and that would be determined to be a medically necessary adjustment. But you could also have, on the other end plate, a chronic area that's gone beyond, you've taken it to a level where you don't anticipate it's going to improve any further, and you could be adjusting there, and that could be considered a wellness adjustment. So when you go to adjust that segment, I mean, you're actually doing both. And think of this all up and down the spine. You've got 7 cervical vertebrae, 12 thoracic, the 5 lumbar, you've got the pelvis. And so you're dealing with a whole person that's walking into your clinic. And I defy you to tell me that you can say definitively that all subluxations for that patient that day are either medically necessary or wellness, either one. There's going to be a mixture of both. So that's not going to work in order for you to differentiate between the two. On the other end of the spectrum, you have groups like Medicare saying, well, if you have more than 24 visits for an adjustment with a Medicare patient in a given year, you're going to be subject to audits. So the fact that you're subject to audits shouldn't determine whether you're providing acute care, you know, medically necessary care, or wellness care. But at the same time, you don't want to run afoul of Medicare and undergo a big audit, so you've got to be careful there. So then you talk to a bunch of the compliance experts out there and you say, well, on the average patient, I'm talking average patient, I'm not talking every patient, because, you know, a child will just need a couple adjustments often, whereas somebody older needs a lot more treatment. But on an average patient, a lot of the compliance and coding experts will say, well, the line of demarcation between medically necessary care and wellness care is 18 visits. Again, a ridiculous number. So what do you do? And quite frankly, I don't know what to tell you what to do other than take each patient individually, and if you think that they've plateaued and you don't really anticipate any further improvement, I'd move them from charging out medically necessary care to change the codes to wellness care and bill appropriately. What factors go into that? You know, it's probably more artistry than it is, you know, fact on what you rely on. Kind of what you know in your gut to be true, and stick with it. If you go over those 18 visits though, you're probably and you're given acute care, you're probably going to run into trouble. Just make sure that your documentation is really solid, and you should be able to weather any sort of audit that you're most likely going to get.